Well, it's really important that we look at global health security. We're trying to build resilience. We're trying to engage a whole community approach to actually focus on all those hazards that we know that are out there. So it's not just the next emerging pandemic threat, but it's actually all the other hazards and the threats that come to evolve around on a daily basis that threaten the health of people in communities. So it actually threatens health systems. So by building up resilience, avoiding critical failure, and ensuring that we have sustainable health systems is really the key. For global health security, I look at this as a holistic, comprehensive approach to taking all the vertical programs that we have for any diseases, capacity building, workforce development, finance, governance, writing legislation, and creating enabling environments. What does it take to ensure that health systems function on a daily basis and they're sustainable and they're also cost effective? We know that we have limited resources with the number of doctors, nurses, hospitals and health clinics that we have in many countries throughout the world. So it's important to take those limited resources and provide the best health care that we can for the populations they need to serve. Whether you're working at the national level, at the provincial or state level, or down at the local district level, people need plans. And once they develop a plan, and we have a system in global health security where we use an external evaluation tool with external evaluation teams, as well as internal, within the country, the location, internal assessments. And then those teams come together and they develop a 5-year global health security roadmap. Now that's great because you've got a really nice document that covers 11 action packages. It's very comprehensive, but it hasn't been operationalized. You don't have a pathway then of how to implement it. So we take these roadmaps that we have developed now in, over 30, 35 countries, and we then develop how to operationalize them from a financial perspective, from a workforce perspective, but also from a sustainability perspective. What can you do and what can't you do, and who do we go and ask for help from? So to be successful in global health security, we need to take a multidisciplinary, multi-sectorial approach. And that's really challenging because people are stuck in the work that they do, a vertical disease program like HIV/AIDS, tuberculosis or malaria, and it's important that we get them to the table and look at how they can work together as a team. So take that whole community approach. Well, it's very important that when we bring them into the table, we're working in a non-threatening environment. Because, as a doctor, we're very passionate about what we do, and I want to see my project or what I do get funded. I need to let go of all that and actually sit down and think, what is the problems or the problems that we're trying to solve here today, identify those problems, go through some what-if case scenarios, but then explain what is needed then to manage all the excessive waste that we got from Ebola hospitals, and how do we do that safely without causing risk or infecting other people within the community? How do we manage the limited number of doctors and nurses we had when we had so many people coming with fever? But fever could be an indication of many diseases, not just one disease like Ebola or even Zika, for example. So it's really important that we have a plan. In that plan, it has defined roles and responsibilities, and we keep to the plan. BMJ has a very vital, critical, important role to play in that with the membership that you have, the respect, the integrity and the trust that this organisation has, the way that you've got certain platforms for adult learning education, the approaches that you have in helping people tell their story, not just how to write a journal article, not just how to write a proposal for that next funding stream that we're looking for, but actually how to tell the story. And that's so important. And we're seeing that in the Internet of Things that we work now, people can tell their story, but they haven't been trained or educated to tell those stories. So we're seeing that the way that BMJ works throughout the world, in the countries of the world, I'd like to take that to scale. I'd like to go to many more countries, include many more organisations, but to start to institutionalise this. Let's start teaching this academically at the universities and the schools, but also within the associations, and make it part of the everyday work that I do and my team does in the field. We see a lot of countries in the world now, physicians, nurses and other medical staff are trying to share their experiences. They're trying to share their findings. They're trying to share their lessons learned, or even just tell stories about the work they do. And we've seen recently the number of journals that have been created in countries like India, Pakistan, Iraq, Indonesia, Nigeria. These journals have just appeared because people are passionate for health. And so it's really important that we help them increase the quality of the storytelling, increase the quality of the articles. We help them with how to be editors. We help them with how to present that information so it's appropriate, but it also helps benefit the whole community. And so as we see this large expanse of journals all around the world, we can now engage with those people and say, well, here's a template, here's a methodology, here's an approach that may be helpful for you.